Hey, this is Doc B coming at you from Turquoise Therapeutics in Santa Fe, New Mexico. Today we're talking about de Quervain's disease or de Quervain's tenosynovitis. This is essentially a tendinopathy or a tendinitis that occurs on the tendons that attach on the base of the thumb. And I'm seeing this quite commonly just recently in the past few weeks. The repetitive microtraumas or repetitive use symptoms from texting too much or scrolling through social media, sometimes people who are gamers and use a gamer's paddle a lot, repetitive use of the thumb, tennis, racket sports, pickleball, paddle sports with a lot of gripping, a lot of thumb action. Essentially, the tendons that attach the base of the thumb, they come up the lateral or the outside edge of the wrist, and then they come up into the forearm and attach further up the forearm with a lot of these extensor muscles. Now, the tendon gets inflamed, and the tendon runs through a sheath. It's a synovial sheath. It's like a tubing that is highly lubricated, but that also gets inflamed and irritated. So now you got the tendon and the sheath which it runs through are inflamed, and it causes acute pain in the wrist. It can be more pronounced with wrist extension. So yoga practitioners, when they're in down dog, that tissue gets pinched between the bones of the wrist and the bones of the forearm, causing really sharp pain there. The tendon and the sheath may make like a squeaking sound or a squeaking sensation through that region of the wrist. Sometimes radial deviation, so when the wrist is kind of deviated towards the radius bone of the forearm, may provoke pain there. This condition is highly treatable. We treat it here in the office all the time, super successfully. And we're going to send you some videos on how we assess this to make sure that we're dealing with the proper tissue. So we'll assess it, and then we'll show you how we treat it successfully here in the clinic. And then maybe most importantly, we'll give you some tools for you to stretch and strengthen and treat this at home, both from a preventative standpoint and proactively after you have this condition. So stay tuned. That content will be coming up. I'd like to thank you so much for taking time out of your day to watch our channel, and we look forward to chatting with you real soon. Have an awesome day.